And I'll go ahead and take that as my cue. Are we letting everyone in?
Yes, I'm doing that right now. They're coming in slowly.
Excellent. Well, with that, I'll go ahead and start if that's okay. Welcome, everyone. Welcome to the North Carolina Council on Developmental Disabilities Self-Advocate Discussion Series. This one is much anticipated. I am Chris Hendricks, the Policy Education Coordinator for the Council. On behalf of the Council, I'm so appreciative of you being here. We are all so thankful that you are here. And I'd like to extend a special thanks to our guest speakers for today, Self-Advocate Chris Smith, Dr. Ricky Scott, and Kai Monast. We are going to offer our full introductions just a little bit later. But before we get to that, this discussion series, for those of you who are new, is a place for North Carolina self-advocates to gather and engage with each other and to talk about things that affect our lives as people experiencing life with intellectual and developmental and other disabilities. And we want this time together to be used to get to know each other and to get to know the Council, where I and other individuals with IDD are leaders, colleagues, and we're valued for our input because we are who we are. Nothing about us without us. People with disabilities should always be valued like that, and this discussion series is meant to demonstrate why and how. This month is going to be a little bit different. We're going to be having a panel discussion around transportation for persons with intellectual and developmental disabilities. Self-advocates will share their experience with transportation and paratransit services, and we will learn how they got involved with transportation advocacy. We'll hear about some of the challenges around transportation, and most importantly, we'll share ideas around solving those challenges. After our self-advocate experts get a chance to share their experiences and perspectives, we'll open it up to you, our attendees, to ask our panelists questions about transportation and transportation advocacy directly. I'm going to go a little bit off script here and ask that if you are a participant, we really want to see and hear you if you are able. So if you can, I'm going to make a request that you come off of your camera, if you're willing, in order to create more connection between everyone. There is just something about seeing your lovely faces and hearing your lovely voices that brings everyone together just a little bit more. You don't have to. This is simply a moment where I'm going to encourage you to do so if you choose to do so. And I'll start by introducing our guest facilitator for today, one of my favorite humans on this planet, Mr. Philip Woodward. So Philip Woodward currently serves as a systems change manager for the North Carolina Council on Developmental Disabilities. He administers contracts for the Council's community living initiatives and is the staff liaison to the Council's Community Living Committee. Philip works collaboratively with state and federal government agencies and nonprofit organizations to achieve systems change that support people with intellectual and other developmental disabilities to fully integrate into their communities. He's also a husband, father, and, as you will soon see, our unofficial dad joke expert. So in line with Philip's expertise, it's only fair that he lead us in our humorous ritual, the joke of the day, as we relax into what is sure to be a very interesting and informative discussion. Please take it away, Philip.
Good afternoon. Thank you, Chris. This is Philip Woodward, System Change Manager at the North Carolina Council on Developmental Disabilities. I'm wearing a purple shirt today, and let's start with the hint that Chris gave, our humor. We'll follow along with the theme of today's discussion. So our first dad joke is, what kind of car lets you watch TV? Any guesses, anybody? Don't be afraid to guess. Going, somebody, Kayla Davis, said smart car. The answer is a cable car, of course. Get it? Cable TV? Let's see if you can get the second joke. What songs do we sing in the car? Any guesses, anybody? If there are no guesses, the answer is cartoons. You know, like Saturday morning cartoons, Looney Tunes. Okay, I hope you enjoyed that bit of humor. Now let's talk about what transportation as a service really means. What is transportation? This is the definition that I found in Wikipedia. Transport in British English, or transportation in American English, is the intentional movement of humans, animals, and goods from one location to another. Modes of transport include air, land, and that could be rail or road, water, cable, pipeline, and outer space. The field can be divided into infrastructure, vehicles, and operations. And basically, transport enables human trade, which is essential for the development of civilizations. So that is your history lesson, even though most of us are out of school for the summer. Let's go to the next slide to see what exactly the Americans with Disabilities Act, or the ADA, says about transportation services. The ADA requires public transit agencies that provide fixed route service to provide complimentary paratransit service to people with disabilities who cannot use the fixed route bus or rail service because of a disability. The ADA regulations specifically define a population of customers who are entitled to this service as a civil right. The regulations also define minimum service characteristics that must be met for this service to be considered equivalent to the fixed route service that it is intended to complement. Now that was a lot of words, so I am going to share a more plain language definition of ADA paratransit. Basically, some public transportation agencies provide fixed route transportation, such as a bus or a train, that follows a specific route from point A to point B. The Americans with Disabilities Act says these agencies must provide an equal service to people with disabilities who are unable to ride a fixed route service like a bus or a train. This paratransit service will usually involve a vehicle picking up the person with a disability at home or close to their home and dropping them off at a specific destination. Lastly, I would like to share how transportation needs and services fit into the Council's mission of serving people with intellectual and other developmental disabilities in the community as part of our 5-year state plan. Goal 2 of our 5-year state plan is to increase community living for people with IDD. Part of this goal is improving access to transportation and transportation services for persons with IDD by identifying and implementing strategies to eliminate barriers through collaboration with transportation agencies, state and local agencies, organizations, and advocacy groups. So this panel discussion today, which you all are here for, is one way in which the Council fulfills this goal. Change begins with a better understanding of the services we have and the challenges and barriers that we face as a community. With that said, It is my pleasure to introduce our first speaker today. It's my pleasure to introduce Christopher Smith. He is a self-advocate who's very passionate about transportation and transportation services. He has been an advocate for people with disabilities ever since he can remember. He has specifically advocated for improvements in transportation over the past 10 years. Chris has shared his story with us, the Council on Developmental Disabilities, with the Raleigh Mayors Committee for Persons with Disabilities, with Disability Rights North Carolina, and other NC advocacy organizations. And now he will share it here. Chris, the floor is yours.
Thank you so much for that introduction. As Philip shared, my name is Christopher Smith. I've been heavily involved in the advocacy for many years. I'm specifically passionate about transportation because I've had some challenging experiences with paratransit and transportation services over the years. I've shared my story with several organizations, including Disability Rights NC, North Carolina Council, and the Raleigh Mayors Committee for Persons with Disabilities. I cannot speak for every person with a disability when it comes to paratransit and transportation services. I can only speak from my own personal experience. With that said, I have faced many difficulties over the years due to either miscommunication or lack of communication. I have been stranded on multiple occasions. One solution for this is to hire more staff that are specifically trained to work with people who have disabilities. I realize that funds are limited, but better trained staff also means we will have an easier time getting out into the world and contributing to our community. It is much more expensive to leave issues unresolved than to invest the funds needed to find a solution. For an example, I have dystonia. If someone at paratransit services does not understand that condition, one solution be to have a medical professional somehow connected to the service. If medical professionals work with paratransit, or if there was a more direct link between doctors and transportation, there would be fewer misunderstandings and it would be easier for people with disabilities to have their needs met. Paratransit would then be more empathetic to the needs of people with disabilities. This makes it easier for paratransit services to develop professional relationship with people like me. Along with a better understanding of conditions comes a better assessments for people with disabilities. Better assessments offer the opportunity for more patients and better experience. Overall, for individuals with disabilities, people often forget that people with disabilities are very diverse. Everyone is different and deserves to be treated with respect based on those individual differences. Overall, there should be more transparency and accountability for transportation services and the companies contracted with them. Whether my travel needs are met or not, we will get much closer to a solution if we feel seen and heard. Thank you for letting me share today.
Well done, Christopher Smith. With that, I'll pass it back to my co-facilitator, Philip Woodward.
This is Philip Woodward here. Thank you, Chris, for being honest and open about your experience. Now that we've heard from one self-advocate, I will pass it back to my co-facilitator, Chris Hendricks, to introduce the first of our panel of experts today.
Thank you, Philip, and thank you, Chris. Thank you so much, Chris Smith, for sharing your experience. Now let's see if our speakers can shed some light on the matter. Please give a warm self-advocate discussion series welcome to our first panel expert, Dr. Ricky Scott. Dr. Scott, you serve as chairman on the Raleigh Mayors Committee for Persons with Disabilities. Is that correct? Please tell us more about your role when you are able, and welcome. We're glad to have you here today.
Thank you very much. Can you all hear me? Hello?
Yes, we can hear you.
Yes, we can.
Yes, we can.
Oh, okay. All right. Yes. Well, thank you all for having me today to come and speak with you in reference to my role with the Mayors Committee. I am the chairman of the Mayors Committee and have been the chairman now since 2019. And I've served on this committee for decades. And one of my chief interests has been related to access to the ADA paratransit system. And as chairperson of this committee, my role is to advocate for persons with disabilities to the ADA paratransit staff and to try to mediate issues and concerns that may arise from access limitations to the service. And, you know, it is challenging due to the nature of the paratransit system here in Raleigh, although I think that when it comes to accessibility, having a system like we have can yield the better results from single provider systems that tend to dominate throughout the country. And so what I've tried to do over the years is try to work with the staff to improve customer service and satisfaction with the service. Sometimes it appears that that is not a high priority as I know it should be. And as long as I'm chair and as long as I've been on this committee, I've tried to work toward that end. And I think with some of the changes, I think that we will see some improvement in customer service satisfaction with the service. We are bringing on a new system, administrative system. I'm sorry, a new administrative company, and they are going to be integrating software that's going to make it similar to how Uber and Lyft work in terms of being able to schedule trips, to know when your trip is to arrive to you. These are just a few of the things that this software is supposed to be able to allow the users to be able to interact directly with staff. So that's what I have for right now, and I certainly look forward to answering any questions.
Dr. Scott, thank you so much. I'm not sure what the implications of that future technology is going to have on the IDD community, but it sounds like you have a pretty positive perspective. And that's really what we need right now, is a positive perspective and just ways of moving forward. We really appreciate you sharing. Is there anything that you would like to share regarding non-technological
Yes.
solutions?
Yes. Well, what I would like to share with people, since we do have a system where we have the taxi cab companies involved in the provision of service, and I do know that people have had challenges with being picked up on time and a variety of issues. What I would urge people to do is to get a list of the providers. This, it may require a bit of work in terms of locating a company that can meet your transportation needs. But if you have a list of them there, if you're not satisfied with one particular company after a series of rides with them, when you're scheduling your trip, request another company. When scheduling trips, I try to urge people to not only use the call in, but if they can, email their trips in. So you won't have to stay on the telephone for 15, 20 minutes times. So those are two things that I think people can do. And thirdly, since individuals do receive or can have trip notifications the day in advance, so they should know who their company may be. I'd recommend that they call the company the next day prior to their trip, about a couple of hours, to make sure that they're going to be picked up on time. Now, hopefully this technology is supposed to resolve some of that, but I'm a firm believer in being able to control some of these processes to the extent possible, so as to ensure that your transportation needs are met. You're picked up on time from where you are, and have your return trip timely manner.
Dr. Scott, thank you so much for that in-depth clarification. I've got one last question for you for now, before we get to the panel portion of our discussion. In chat, Catherine Lizak, forgive me if I mispronounced that last name, has a question. Is there an ETA on the new software system?
Yes, supposedly, the operational part of it is supposed to be effective July 1st. The software part, which will be the part where the consumers or riders will be able to interact with, supposedly August 1st. But, we know how it is when transition occurs. Glitches may occur, but those are the target dates. But I would not be surprised in terms of, that it may be, a month later, especially with the software part of it. But those were the dates that I was given. But I would take that not as a hard and fast guarantee, but that's a target date.
Thank you, Ricky. Like I said, even if it's a target date and it doesn't wind up being a date, it is still what I would consider hopeful information. And I want to steal back just the last minute or so that we have, and I apologize to our participants and our listeners for doing this in reverse, but Dr. Scott was being humble in his initial introduction. He has advocated for the rights of persons with disabilities for many, many years, as he shared. He's been a voting rights advocate and education advocate with Disability Rights North Carolina. He has a Bachelor's of Science from UNC Chapel Hill, a Master's of Science from UNC Charlotte, and a Doctorate of Education from North Carolina State University. So in other words, we're very grateful to have him here, and he is much, much smarter than me. So thank you, Dr. Scott, for being with us here today. Really appreciate it.
You're so welcome, and thank you very much for those words.
It's easy to say when it's true.
Yes, sir.
Well, it is my honor to introduce our next panel expert, Kai Monast. Welcome, Kai. I'm so glad to have you here with us today, and thank you for all your correspondence with me. Really appreciate you being here with us. Kai Monast is the Director of the Public Transportation Group at the Institute for Transportation Research and Education at North Carolina State University. Kai works very closely with public transportation systems, the State Department of Transportation, and other industry stakeholders to provide training, assistance with technology implementations, and advice for operational improvements, as well as conducting original research. He earned a doctorate in city and regional planning from UNC Chapel Hill with research focused on performance measurement for public transportation. Welcome again, Kai.
Thank you, Chris. So as Chris indicated, I'm Kai Monast, and I would like to take Philip's lead here and explain that I am in my office at NC State. I'm wearing a black shirt with an ITRI logo on it. And so you might wonder why I am here. This council reached out to Ryan Brumfield at North Carolina Department of Transportation, and he has asked me to attend because we work very closely together on mobility issues across the state. NCDOT contracts with my organization, which is called ITRI, and that contract allows ITRI to provide technical assistance to transit systems across the state. So that's why we're here. That's why I am here today. And I would like to share a few things about where I believe public transportation is in North Carolina and where we are trying to make it go in the future. So the last two stories that we heard were about Raleigh and urban transportation. We obviously work with urban transportation, but there's a huge need for rural mobility as well. And I noticed when I registered for this event that we do ask whether people are in rural or urban areas. I don't have the list of who is where, but I'm going to speak about both areas. So in North Carolina, we have a baseline level of mobility in every single community. The state invests in something called Rural Operating Assistance Program, which provides money to counties, and that money the counties then use to, and they're in three different sources. One is rural general public, one is elderly and persons with disabilities, and one is for employment. And so every county gets money from the state to provide some level of mobility. Plus we have federal money and other state money that goes into providing access. So in our rural areas, we have demand response transportation, which looks very similar to what Philip described earlier as the ADA transportation, where you request a trip, a vehicle will arrive at your door and pick you up and take you to that destination. So that's across almost every single rural area in North Carolina. In the urban areas, you have fixed route, which are the big buses or the trains. And associated with those fixed routes are the ADA complementary demand response transportation services that Philip described. And what we have now is a new kind of service called on-demand microtransit that's being deployed across the state. And the difference between on-demand microtransit and demand response is that the microtransit service is designed to decrease the time between when you think about wanting the trip and when you can actually have the trip served. So if you're in a rural area, if you want to go somewhere, you may have to make a reservation 2 days ahead of time. But with microtransit, because it's technology enabled, you should theoretically be able to open up the app, request a trip, and have service within a matter of an hour or somewhere around an hour. And so that enables people to have a lot more spontaneous of a life and gives them a lot more freedom. It's now just now being deployed in areas across the state, but it is a very popular method. And our challenges with microtransit are not just how to start microtransit, but it's how to maintain microtransit because it's so popular and ends up costing a lot of money. So those are the main types of public transportation that we have. But we do know, even with microtransit coming about, there's still a difference between people who have a personal car and can drive that car and people who cannot. There's still a huge level of a disparity in the level of access that they have. So if you have a car and you can drive the car, then you can go places anywhere you want, anytime you want. But if you don't have a car, or you cannot drive the car, or even if you choose not to drive a car, you cannot access that many places. But our vision is to create a connected statewide network that everyone is able to access, where reservations for public transportation are not required. They can be taken, but they are not required. And where everyone can manage their own trips if they want to, using mobile technologies. So given that vision, there are a few things that are going well and a few things that we need to work on that I just wanted to address quickly. First off, the public transportation industry in North Carolina is full of wonderful, dedicated people, and they are restrained or constrained in the resources they have available in many cases. But almost everyone in the industry has their hearts in the right place, and that is a very large strength that we have. In addition, we have organizations like this one that brings to the table a strong, very highly engaged ridership group. And the more ridership engagement we get in public transportation, the stronger public transportation is going to be. So those are very big positives. Some of the recent difficulties that we've been having is it's been hard to hire drivers or operators, especially since the pandemic. It's been very difficult to either hire or keep people in public transit as drivers. We've also had a lot of difficulty because of supply chain issues in purchasing vehicles. So we should have had replaced a lot of vehicles, but those vehicles are still on the road because we're just not able to find the proper vehicles. They're just not being made. They're not available. And then some bigger picture, long-term visions that we share, and I'm sure I share with you, is that even though we have public transportation across the entire state, it doesn't have long enough operating hours. So sometimes public transportation is only offer from 8 a.m. until 5 p.m. Well, we need to have longer hours so people who are working outside those times have access, or people who want to go out to dinner have access to public transportation. And so not just longer hours, but we also need to expand our operating days, because a lot of the times we don't operate on weekends, we don't operate on holidays. So that needs to be addressed. One issue, well, it's an opportunity and a challenge at the same time, is what's going on with Medicaid transformation in the state. So in our rural areas, Medicaid trips enabled the rural transit systems to keep driving around. They kept the vehicles on the road. And it paid for a lot, and it just kept the vehicles moving. And it was when those vehicles are out in your community, well, then it doesn't cost much to go and pick up someone who's not Medicaid funded. But with Medicaid transformation, there is a concern that the amount of miles that are being driven by rural transit systems are going to decrease significantly. And if that happens, then people who are not funded with Medicaid money are going to have greater mobility challenges. Some other challenges that we face kind of in the long term is that we still need to be sure that all of our vehicles are fully accessible. So, and this comes about with microtransit a lot, is that some of the new microtransit sites, they're not using completely 100% fully accessible vehicles. And so given that case, we're not confident that we're able to provide equivalent service between people who maybe need a wheelchair lift equipped vehicle and those who do not. We have to make sure that those two types of services are equivalent. And so we need to have fully accessible vehicles. And we also, as did he lose the doctor?
This is Chris Hendricks. Dr. Scott, is that who you're?
Yes, Dr. Scott. Dr. Scott, I think he might have left us. As Dr. Scott was saying, the technology is very important. And so there's no one thing to have rider or customer facing technologies, but those technologies have to be accessible to everyone as well. And so we've got to make sure that all the technologies, which are wonderful, but we have to make sure they're fully accessible, just like the vehicles are. And then related to, in some ways, to Medicaid transformation, but in other ways, just to politics, local politics, is that it can be unacceptably difficult to travel across jurisdictional boundaries. And so some of that money that the state provides goes to a county, and that county doesn't have policies that enable trips to be funded that go into other counties. And we have 100 counties in North Carolina, and our urbanized areas especially serve multiple counties. And it's not, someone with a car can easily get into their car and drive across multiple counties to serve their travel needs. But someone that doesn't have their own car, can't drive it, sometimes finds that these jurisdictional boundaries are almost impossible to overcome. I heard a presentation last night in Durham about how difficult it is if you are using complimentary ADA paratransit in Durham and you want to go into Chapel Hill, you have to stop at Walmart, and Durham will take you to Walmart on 15501, but you have to stop there and wait for a Chapel Hill Easy Ride vehicle to come and get you. And that is just extremely challenging. And so these jurisdictional issues, they've been around forever, they will stay around forever, but it's something that we're definitely aware are causing issues, mobility issues. And then it's not just cross-jurisdictional travel, but Philip has brought up to me a couple of other issues, which are long-distance travel, how difficult it can be to carry people long distances. Yes, it crosses jurisdictions, but also it's just a trip from Charlotte to Raleigh or Charlotte to Greensboro is almost impossible to stitch together as a just general member of the general public. And this is what I told Philip when he brought me that question, is I could probably figure it out, but I have 20 years of experience in the industry, and I'm very uniquely situated to say this is how we can put it together. And that's unacceptable. It shouldn't take someone with 20 years and a PhD in this industry to figure out how to travel across communities. We should make it easy. Well, one of the ways that we're going to begin making it easy is to develop mobility hubs. And mobility hubs are physical places. They're like stations. You consider it a bus station, but it's not just for buses. It's for all of the mobility resources in a community to come together. So you have microtransit, demand response, fixed route, light rail, intercity bus, such as Greyhound, and even your Amtrak buses. If we can get them all to come to the same places, then we can stitch together our network a lot better. And so along with those mobility hubs, we also need mobility managers. And this is an idea that's been around for a while, but it hasn't been fully implemented in the state. But a mobility manager is that person who can do what I was just explaining, where you can put together all of the resources to enable someone to access where they need to go. And sometimes it's very difficult. So sometimes we actually need a human who's hired in a region or a county or some kind of area that anyone can call and say, I have this mobility need. How can I get that met? And that person can say, okay, they'll work with the transportation providers, and they'll say, look, we'll go pick you up at your house, take you here, and then we're going to transfer you to this vehicle, and then you're going to get to your destination. So that mobility manager is going to make it easier for people to put these trips together. And I know I shared a lot, so I'm going to stop talking there. And I think there's some questions in the chat, which, Chris, do you want me to address right now?
Well, you certainly can, but I'll just share very quickly that your timing is perfect. And let me just apologize for mispronouncing your name, Kai Monast. Is that correct? Is that a better pronunciation?
That is correct. Everybody mispronounces my name, so it's okay.
Well, thank you for sharing all of that information. It was quite a bit. Ladies and gentlemen, it sounds like Kai shared some very honest information about the challenges that we face with transportation, but also, once again, offered some hope and some solutions. And with that, I'll just quickly say, before we address the questions in the chat, that now it is indeed your turn, participants. So I will take a moment to just encourage you again, if you're able, please turn on your cameras, and you'll have an opportunity to ask questions to our two panel experts around transportation. We've offered 4 questions as examples for you to ask. You do not necessarily have to ask those questions. You can ask whatever ones you choose, but I'll just read them really quickly. One is, what does accessible transportation look like to you? Number 2, what is missing from accessible transportation, in your opinion? Number 3, why is accessible transportation important to you? And number 4, what positive transportations stories do you have? And with that said, I will throw it back to Kai to address the questions in the chat. And after those questions are addressed, I'll throw it back to our participants to share any questions they might have around transportation to our experts. Go right ahead.
Okay, thank you. Looking here, I see that Philip was clarifying some of the special terminology that we use in transportation. So thank you, Philip. I was worried I was going to use terms that nobody outside the industry understands. So thank you for fixing that for me. And then it looks like there are 2 specific stories about the challenges with cross-jurisdictional travel. And then Laura has a question about our system, I believe. So Laura, I do not operate a system, but so I don't know if there's a particular transit system you're mentioning in your question of, does your system require an app? Since some people do not have those kind of phones or do not have access to a debit card. But I think I understand now that I read the whole thing. One of the things that we're working on is ensuring that microtransit does not require you to have the technology, that everyone has access. So you can pick up the phone and call, or you can use the app, it's up to you, or you can have advocates help you book the trip yourself. So no, you would not be required to use a mobile app to access microtransit. And I'm sorry, you also asked about the credit card. No, some systems do require a credit card, and we are trying very hard to ensure that never happens again.
This is Chris Hendricks. Thank you for addressing those questions, Kai. Self-advocates, now is your chance. We've got 2 brilliant experts with us today, and they have shared with us some wonderful information, and they are here to answer your curious questions. So however you would like to jump into the fray, you're welcome to ask your questions in the chat. You're welcome to unmute and ask your questions that way. And you're welcome to use the Zoom hand signal to ask your question. And I and my colleagues will do our absolute best to field any questions that you may have. And I know for a fact that there are some participants here today that have some questions. So don't be shy.
The first hand that's raised is Laura Newells.
Laura, go right ahead with your question. This is Chris.
Don't forget to come off chat, Laura. I mean, mute. Laura, it seems like you're still having some technical difficulty. Do you mind if we move on to Jeff Pierre-Gary and then we'll come back to you? All right, Jeff, go ahead while Laura tries to work out her.
Yes, my question is for Kai. Could you explain more about the app? And is the app? My question about the app. Could you explain more about the app for people in Guilford County? And is it a free app for an iPad? Could you explain like how the app works?
Yes, so I don't think Guilford County has an app right now. But when
Just one.
yeah, when they do have an app, the way it will work is you will have just like if you've used Uber or Lyft, you will have location enabled on your mobile device, and then you'll go into your account and request a trip, and your account will allow you to designate whether you have mobility impairments. So if you need a wheelchair accessible vehicle or some other assistance, you can indicate that in your account. You will request a trip, you put in your origin and your destination, and then that vehicle, if it's on demand, whichever vehicle's available first will then come to your door, pick you up and take you to that destination. And you should be able to follow it all on your phone, so you can see the vehicle before it arrives, and then you can pay if there's a fare involved. You can pay in that app, or hopefully that's not required, and you can also use a fare pass or cash if you need to. But there are a lot of different companies that provide this service, and there's a lot of different ways to set up the service. And so we did a study on microtransit North Carolina, and we found that there were 7 sites with microtransit, and they all look and act completely different. So there's a lot of local control over how it is implemented.
Kai, this is Chris. Thank you so much for addressing that question. And Kayla has asked me to read her vision in the chat. Kayla says, I would envision an app where I could arrange power chair accessible transportation for appointments, errands, or pre-arranged transportation for travel for recreational purposes. Kai, do you have anything to say regarding that vision?
I love that vision. You should be able to do exactly that. And you will be able to do that. It's just a matter of, I don't know where you live, Kayla, but certain communities are moving faster.
Laura Newell, this is Chris Hendricks. I'm just checking in. Are you able to share?
Looks like you were off of mute, Laura, and now you are back on mute. And we still cannot hear you.
Laura, if technology continues to be a challenge, it's been a challenge for me today. Technology and I have never really gotten along, so don't feel bad. Feel free to share your question in chat, and I'm happy to share that question out for you, or Kai can read it, or however you wish to be heard. And Kai, just for your knowledge, Kayla says that she lives outside of Asheville.
See that, and I was going to respond, Kayla, that McDowell County is working on microtransit. There's a grant for them to implement microtransit. I'm not aware of any other community around Asheville besides McDowell County at the moment.
This is Melissa. I just want to interject that Dr. Ricky Scott from the Raleigh Mayors Commission is still on the line with us. If you have questions for him, or as Chris stated, there are 4 different questions for folks to ask if they don't have specific questions for Kai or Dr. Scott. And there's some more hands up. So you want to call them, Chris?
I see that there are hands up, but I'm not seeing who.
All right, it looks like Laura still has her hand up, and then Chris Smith has his hand up. So Chris, you want to go ahead and ask your question, Chris Smith?
Hi, my name is Christopher Smith once again, and I was wondering about the new system. So with the new system, now, Ricky, you said one of them starts July 1st and something else started August 1st. Can you tell me that again?
Yes, the operational side of it, meaning that on July the 1st, the administrating company will be taking over the operations of Go Raleigh Access and the other systems, bus system for the city and the county service. So it will take over those 3 operations, combining it under one administrative system company called RapDev. And in August or September, the software side of it, that's where the companies who are providing paratransit will be integrated into the system to where they will be able to receive trips and their apps on their phones, and the individuals should be able to interact with this system just like you would with Uber or Lyft. Like I said, doesn't happen in August, don't be surprised, because they're still trying to work out the logistics, but that's the target date.
Thank you, Dr. Scott, for addressing that question. And I just want to mention very quickly that just based on time, I think we've got time for one more question. And I just want to direct, Philip shared in the chat, I'll just throw this out there. If anyone has any positive transportation stories they'd like to share, please share them as a final discussion point before we go to resources, or if you have a question.
Chris, this is Letha. Matthew Schwab has had his hand raised for a minute.
Matthew Schwab, please share or ask a question as you're able.
So it's kind of a little bit of sharing and a question
question. So, for my transportation, I do Lyft only for my supplementary transportation for one route, but that's through my MCO, Alliance Health, through the state innovations waiver. I've been having trouble in loading my gift cards on because there are 3 parties that are involved: Alliance Health, Amazon, who distributes the gift card, and we have been haggling them for months and months because for some reason I'm getting invalid code, even though it's the right code, or just plain out error. I just want to ask, is there any problem with on that end?
I feel like I need a little bit more information, Matthew. So are you saying the gift card that pays for Lyft, you're having trouble with that?
Yes, and it's been very tiresome for me and my mom, and even tiresome for Alliance Health, my MCO. So we're haggling each party, and so we're trying to figure out why it's saying error or invalid PIN, even though we put it in correctly.
I understand that would be very frustrating. I don't know anything about how Alliance Health is working with Lyft, so I can't tell you other than it needs to be handled with Alliance Health. But also, if you can't get what you need out of them, you could contact the state DHHS because they're in charge of the contract with Alliance Health.
All right. Thanks.
Yeah.
Thank you, Matthew, and thank you, Kai, for addressing this. As you can see in the chat, there's stories are continuing to be shared, and there are still some questions. I'll just quickly ask, is there a way for people here to reach out to you all respectfully and directly? Is that appropriate, or should we consider having a part 2? Any thoughts?
Me personally, part 2 would be wonderful. If you would like a part 2, let's do it. And I put my email in the chat.
Thank you so very much, Kai, and Dr. Ricky Scott. Does that sound okay with you? A part 2 at some point? It looks like we're getting an ask in the chat for that. Not to put you on the
Yes.
spot, sir.
Oh, no, that's fine. Yes, that's fine with me. And if anyone has any questions that they wish to send to me via email, Mr. Hendricks has my email, but let me give it. It's rickyscott09@gmail.com. I'd be more than happy to try to address them.
Thank you so much, Dr. Scott, and I will add those emails as part of our the resources email that I will send out to all of our attendees today. For attending your session, you get a handy dandy resource email if you have any more questions that some of these resources can address, and I'll pass it back to my co-facilitator, Philip Woodward, to go over some of these resources.
This is Philip Woodward here. We have a slide up with some general transportation resources. These include the National Aging and Disability Transportation Center, Easter Seal Transportation Group, the NC Department of Transportation Disability Resource Center, and every year the NC Department of Transportation hosts a Transportation Summit. And one of these has videos from this year's summit in January. You can also find local resources such as the Transportation Directory by county, and Go Raleigh Access is the Raleigh site, but you can find whatever city you live in or whatever county you live in to see what their website on transportation services for people with disabilities says. Thank you very much. I will pass it back to Chris.
Thank you so much, Philip, for being such a great co-facilitator. Thank you to everyone who has worked so hard behind the scenes. Thank you to our ASL interpreters, Jenny and Ernest. Thank you to our Spanish interpreters. Thank you to the North Carolina Council staff. This has been really informative, and just to put things into perspective, we have 4 or 5 requests in the chat for a part 2. Along with 2 or 3 other questions and stories. And just to let you know about our upcoming sessions, and some important dates to keep in mind. June 22nd, we've got the anniversary of the Olmsted decision. And on Wednesday, July 19th, really quickly, June 22nd, just so you all know, that's tomorrow, the anniversary of the Olmsted decision. Next month, Wednesday, July 19th, we have our next self-advocate discussion series around comfortable conversations. And July 26th, of course, is the anniversary of the signing of the Americans with Disabilities Act. We really appreciate all of our guest speakers today, Kai Monast and Dr. Ricky Scott, and of course, our self-advocate presenter, Christopher Smith. Thank you all so much for being here with us. And we hope that you will sign up and join us for our next self-advocate discussion series, along with any events that the council has going on. We appreciate all of your time today. Thank you all so much.
Bye, everybody. Thank you for everything. What a great session.
Very good session today.